Welcome back to one of our final videos here for IVCC students and all others that are patiently paying attention to some of the first lay responder informations that will help you in the heat of the moment for different situations. Last time we covered water-related emergencies. Today, with this video, we're going to cover pediatric, older adult, as well as special situations. So this is one of our final videos for the semester. Be prepared for an exam coming up, a couple exams actually. We have a 30-point, 30 multiple choice question first aid exam, and then next week we will also have our final examination covering all information from the whole semester. Blackboard is going to be the one and only way to work right now for us until IVCC is unhacked and we can open up our emails again. So again, Blackboard is going to be the way I send you all this. I'm going to need you to reply information back to me via my email, which is lowercase fog0845 at yahoo.com. And of course you have my cell phone number, so you can contact me at any given time you choose to. Let's look into these pediatrics. So let's go ahead and figure out some age ranges first and foremost. For infants, we're looking at kids birth to 1 year. For toddlers, we're looking at kids 1 to 2. Maybe they're starting to be able to formulate some words now, right? Ooh, sorry, Carhartt. Look at her, he's so cute today. Number 3 is preschoolers. Those would be ages 3 through 5. Now they can make more sense of what's going on, but still not perfect with helping you understand what could be happening with them. School-age kids would be 6 to 12. Now they're more than capable of explaining usually what's going on. Finally, we have adolescents, ages 13 through 18. Now we're getting to the point where you maybe don't need as much parental consent to start helping them. You still want to ask them where their parents are, because you always want to address those things. But again, we can help those people much more easily because they can explain what's going on. They're usually more mature for those situations, hopefully speaking. Your book has a great picture of a lady holding her child while a first lay responder is helping. That's one of the best things you can always do is observe the child or infant before touching them, even letting the parent or guardian hold the child while you're doing those initial checks. Now, of course, if it's a head, neck, or spinal cord injury, we're going to want to inform that parent that we need to lay that child on the ground and not move them from the position found. Pretty obvious with those. But for all other conditions, it should be pretty overall safe to let the parent hold the child unless it's a life-threatening condition, right? With a child, we're always going to start from the toes and work our way up to the head. So by checking out the toes first, we're not putting instant fear into them that there's something wrong with their head possibly, right? We're lightening the situation so they don't have as much anxiety. That way we can keep it all in much more control. And then lastly, right, we can ask the child to point or tell you any place that it hurts. This is a great way to doing so that way we don't cause any harm, we don't give them any anxiety about, you know, I'm a stranger and I'm checking them, right? We want to keep them in a most carefree state as possible given the injury, if possible. It's hard to do, but hey, we'll see. A lot of times kids make injuries bigger than what they are, but let's be serious here. Let's be serious with these severe injuries and when we need to contact 911. Carhartt, be quiet. Come here. Come on. Let's go with abdominal pain first, okay? This could be something that could be common with kids. And primarily with kids, what's going on with them is that they could be having some kind of indigestion process going on, problems. Consider these being possible serious when accompanied with any of these signals, okay? So if they have sudden onset of severe pain, they have pain that worsens over time, they have excessive vomiting or diarrhea going on, they have blood in their stool, maybe their abdomen is severely bloated or swollen, they have a change in their level of consciousness, or they have signals of a shock. We have to treat these abdominal pain symptoms as serious. It's best case scenario to call 911 for a suspected life-threatening condition. In the meantime, like usual, we have the child rest in the most comfortable position possible, keep from being overheated, over chilled, assure the kid that everything is going to be all right, and care for the basic conditions found. Another scenario that we could be involved in is child abuse. Okay? Now with child abuse, injuries do not fit the description or cause, meaning that when the kid tells you what happened, right, it doesn't make any sense. Usually with kids, when they have an injury, they're kind of trying to show it off. Oh, look at this. I got this scrape on my elbow from when I jumped off my bike. You know, they have crazy cool explanations for what happened. But if they're hesitant or uncertain or making stuff up completely out of nowhere that makes no sense to the injury, right? Now we have to suspect that there could be something bad going on. Another signal could be that there are fractures to a child younger than the age of 2, and they are unexplained, fractures to bones. There could be bruises, there could be burns in unusual shapes or places. Even sometimes just grabbing a child by your hand, you can see the imprint, right, from a bruise being there, especially if they're grabbed very hard. There could be injuries at various stages of healing, right? If there's various injuries going on unexplained, it's kind of starting to click here, what's going on. Other things, there could be unexplained lacerations or burns. There could be injuries to their genitalia. Maybe you're a caregiver and you change the child's diapers. You know, there's just horrible red diaper rash over the child's genitals, right? That's child abuse right there. You're not taking care of the child properly. You're not changing their diaper regularly. You're not giving them good quality creams to help soothe their skin, things like that, right? That's definitely child abuse. If there's pain when the child sits, right? That's child abuse too. And other things that we're looking at, more injuries than are typical for a child that age. You know, these are all causes for concern. What we could do is go to our supervisor. We could talk to our supervisor if it's at a place of work where we're a caregiver for a child. Other things we can always do is contact authorities, contact 911. We can call DCFS. These are all organizations which are there to help protect children first and foremost, even 911, right? Call them when you fear child abuse could be going on. And they'll do a proper investigation and figure out what's going on for real. Other things for signs of neglect for kids, one would be no adult supervision. They're just left to be on their own, essentially. They could look malnourished. Other things, they could have poor hygiene. They smell funny, right? Stinky kids means neglect. Unsafe living environments, right? They live in unsafe places, a lot of animals around, or so on and so forth, dirty environments. And lastly, but not least, if they have any untreated chronic illnesses going on, right? If the illnesses are untreated, they're definitely being neglected. So again, if you suspect this is going on, your priority is to care for injuries or illnesses first, and then decide if these are merited to call 911 for EMS to help for, again, severe injuries. Or we can just call the police, 911, and they can respond to help with those, maybe explain those concerns to them about child abuse. Of course, DCFS is another agency, but 911, one of the best ways to start getting the ball rolling right off the bat. Kids tend to be victims of diarrhea, I should say, diarrhea and vomiting more often than other individuals. One, because water. Do they want to drink it? No, they want juice, they want soda, they want coffee these days. I mean, kids are drinking everything under the sun except water, it seems like. So what we can do if we fear that a kid is getting dehydrated or is vomiting, right, persistently, getting to the point of dehydration, is that we can contact a medical care provider and they can tell you what to do, right? They'll look for fevers. They'll ask for those things. They'll ask you about bloody or black stool, or when the last time they actually made a bowel movement, or urine too. Sometimes you can't tell, right? You can't tell if a kid is going through problems because they can't tell you. They're 1 year old. How are they going to tell you, oh, I feel dehydrated, or I'm really sick, right? You have to look for those things. So instead what you'll see is maybe the child is unusually sleepy, unresponsive, or irritable. They could be crying and there's no tears being produced. They have a very dry mouth. The child's abdomen could be sunken in. Their eyes or cheeks could be sunken in. That's a telltale of dehydration. Other things that we're looking at, maybe if it's an infant, right, under a very young child, there could be a sunken soft spot at the top of their head, right? This is actually where the bones are forming right here. And there's always a soft spot, a fontanelle is what it's called, at the top portions of the head here. But this one primarily, more posteriorly, is larger fontanelle. And if that is sunken in, that's always a telltale that there's severe dehydration going on with the child. And last but not least, maybe the skin. Maybe you gently pinch their skin somewhere on their arm or leg or body, and you notice that it tense. It stays pinched before it is, and when you release it, it doesn't sink back into how normal skin is. Definite telltale that there's dehydration going on. So basic care for dehydration and diarrhea, okay? With diarrhea, if eating or drinking less than normal, go ahead and give the child an available oral rehydration solution. meaning Pedialyte, meaning Gatorade, meaning Powerade, something of that nature. But again, Pedialyte's going to give you the best amount of vitamins and minerals possible for that child with those electrolytes to replenish them. Things we do not do. We do not give over-the-counter medications to children younger than the age of 2 without guidance from your medical care provider. So call your doctor. They're going to give you the best information possible to help this child in this current situation. A couple other things we're going to want to do. We're going to want to limit the amount of sugar and limit the amount of artificial sweeteners that this child is consuming. We're going to want to think BRAT. BRAT is an acronym, B-R-A-T. B is bananas, R is rice, A is apples or applesauce, and then T is toast. These are 4 foods which would be great to give to a child that is going through diarrhea. Bananas, rice, applesauce, toast. Easy to chew, easy to swallow, give you a good source of carbohydrates, which are going to allow the child to hold on to more water in their body, right? And also some electrolytes too, especially with the bananas. Now, care for vomiting. Instead of diarrhea, we're looking at vomiting. Vomiting, what we're going to want to do is lay a very young child or infant on their side first and foremost, because again, we don't want them puking and then choking on that. So lay them on their side. We're going to halt all solid foods for 24 hours. So when we put them to bed, lay them on their side, right? Make sure they're in a comfortable position. Check them periodically. We don't want them rolling over onto their back and then choking on their vomit possibly. We're going to give them only clear fluids or those oral rehydration solutions. So water, maybe apple juice half water, maybe lemonade half water, right? Or of course Pedialyte is one of the best things that you can ever give a child. And introduce these liquids slowly, small sips to start with. It's always the best. After 12 to 24 hours with no vomiting, now we can gradually reintroduce their normal diet. Another type of injury for a child we're looking at, earaches or ear infections. These were common for me when I was a baby, especially when I was around my grandparents who smoked a lot. My mom didn't like that, right? So she actually said, you know, as soon as she found out I was getting ear infections from that, no more smoking allowed around Kyle anymore. He's gonna get sick. I'll clear my throat, my ears will get all infected, I'll be in pain, crying all night. My parents didn't like that, so, right, we can look at some of the environments that a child could be in. Thankful to this day, I haven't had an ear infection ever since I was like 1.5, 2 years old. Again, smoking was the factor that was causing that for me. Other kids will have problems with earaches because their eustachian tube is still straight. And until their head grows bigger, then the eustachian tube shoots downward, and now fluid can drain down into their throat, and there's no infection to be had. That's why they usually put tubes in a child's ears to help divert that fluid out of the ear canal, so that way they don't have an ear infection go on, and those can be removed later on once their head has grown appropriately. But common signs, or signals we could say, because again, we can't always ask a 1-year-old, are you having an ear infection? But there could be pain. They could be irritable. They could be tugging at their ear, right? Maybe grabbing at their ear. They're going to have a fever going on. They're going to have maybe some fluid draining from their ear. They could have trouble hearing you. Their appetite will be little to non-existent. And they'll definitely have trouble sleeping going on with these. So what we can do is we can contact a healthcare provider, especially if it lasts longer than 1 day. If there's any blood or pussy discharge, we call 911. If there's hearing problems, we contact our medical care provider for the best information possible. And if the signals do not improve or they're getting worse after treatment, take the child to the hospital, plain and simple. Fever is one of the biggest telltales that there's a problem going on with a person or especially a child. And a fever is considered a body temperature that is above 100.4 degrees Fahrenheit. 103 degrees is considered a very high fever. This is considered life-threatening. Okay. Now, these can also result from a febrile seizure, okay, a fever. So if a child is having a seizure, that's going to make their body temperature jack up exponentially. And now we have a problem going on. Good reason to call 911 for a febrile seizure. Now, a child with a fever, oftentimes they will feel hot to the touch. They'll complain about being cold or chilled. They'll have body aches, maybe a headache going on. They won't sleep very well, and they'll usually appear very drowsy and have little to no appetite going on. Now, for an infant, right, with a fever, since they cannot communicate as much, they're going to be very upset or fussy, and they'll be crying a lot. They could be unusually quiet though as well, so you have to look at those signals, accompanied with the fever, of course. So if they feel hot or super warm. Look also to their breathing rate. If it's very rapid and they also have a rapid heart rate, definite sign of a fever going on. And last but not least, stops eating or stops sleeping normally. Also, always suspect that there could be a fever going on. So if there is a severe fever, right, something that's 103 degrees or higher, this would be a good situation for us to call 911 or the local emergency number. So these are life-threatening conditions: 103 degree temperature, vomiting blood, passing blood, whatever it may be, completely unconscious. If the child has a seizure, if a seizure lasts 5 minutes or longer, is repeated, call 911, plain and simple. Now, you want to contact your healthcare provider for other situations. Say, for instance, that's an infant younger than 3 months with a fever of 100.4. 100.4, and it's a child under the age of 3. Call your doctor. They're going to give you the best information possible to help the child in the situation. Anything higher than that, go to the doctor immediately. Number 2, a child younger than 2 has a fever of 103 degrees or higher. Good reason to call 911, call your doctor, get some help. They're probably going to recommend that if the child is conscious, to sip small amounts of fluid, cool fluid, and then probably submerge the child up to the neck in cool water. Not cold water, but cool water to drop the body temperature. If there is a fever going on, make sure the child is comfortable. Encourage rest. Don't let them play, because that's only going to increase their body temperature. Okay? Drink those fluids, like I said, but small sips at a time. We never give a child aspirin. And for a very high fever, the best way to cool them is to remove excessive clothing and blankets, or even give them a sponge or a lukewarm bath, or submerge them up to the neck in cooler water and then check their temperature with a thermometer, trying to get that body temperature down from those higher amounts. Again, when in doubt, call 911. That's always best to do to make sure we're continuing with safety for the child. Let's get into injuries now for kids. So this is actually the #1 cause of death for children over the age of 6 months. And relatively small amount of blood is lost for an adult in comparison to what would be a large amount of blood for a child. So what I'm basically saying is that if you lose a small amount of blood as an adult, the same amount of blood lost from a child is very detrimental, because that's like 2 to 3 times as much blood for their body volume, right? They're losing a lot of blood for their body size. Very dangerous. Head injuries are actually the most common type of injury we're going to see with a bodily injury like this for kids. So do look at those. Look for head injuries. Of course, call 911 for any of those. Poisonings. These are also possibilities with unintentional deaths. One of the top 10 causes of unintentional deaths for children, adolescents, and infants is poisonings. So with children younger than the age of 6, they're the ones that are going to be the most susceptible, because they are being in contact with the most common things like household products and medications. They're fascinated by these things, right? We need to keep these things out of sight, out of mind, first and foremost, to protect in the first place. If you do suspect any of these medications being consumed or poisonings happening, call 911 or the Poison Control Center. SIDS, SIDS, Sudden Infant Death Syndrome. This is something that is considered sudden, unexpected, unexplained death from an apparently healthy baby. There's no rhyme or reason why it happens. It can just happen. I had a friend, this happened to her when her baby was less than 3 months old. It was a very sad, horrible situation, and there's nothing she could have done. It's not her fault. It's just what SIDS is. It's actually the 3rd leading cause of death for infants between the ages of 1 month and 1 year of age. And it usually occurs during the child's sleeping cycle. The best thing we can do if we do suspect this has happened is care for the same way as we would for a cardiac condition or a cardiac arrest. We're going to give CPR. We're going to call 911 and give CPR, right? This is a severe life-threatening condition. Baby's not breathing. Call 911, begin CPR. 2 rescue breaths, 30 compressions, 2 rescue breaths. Do that for 5 full bouts for our 2-minute cycle, and then check, and then continue again if necessary. Excuse me. All right, let's get away from children now. Let's jump into older adults for a little bit. Generally, we consider people over the age of 65 as those peoples. What we see is with normal aging, we have lungs that become less efficient. We have amount of blood that is being pumped by the heart, it's decreasing. The heart rate is going to slow over time. The blood vessels are going to get harder. They're going to have hearing and vision loss over time. And the reflexes, of course, are going to be much slower. With older adults, what we can do is always, when we're checking them, right, we first and foremost want to tell them who we are, right, and use their name. So Betty, right? Hi Betty, my name's Kyle, I'm certified in first aid. I saw you took a little fall here, can I help you? Okay, she knows who you are, you know who she is, use her name. Old people love it when you use their name. You know, make sure that you are being very respectful to them, right? Give them their dignity. Always try to position yourself at their eye level, just like you would with a child, because if they fall down, right, they're not going to want to necessarily try to get back up right away. Keep them in position found and talk to them. Relay information back and forth and help them the best way possible. Sometimes their aids might fall off of them, like their glasses or their hearing aid, so locate those if needed. And speak slowly and very clearly at the start, and really look at their face to make sure they're comprehending everything you're saying. Ask them about medications or any known kind of medical conditions going on with whatever's going on. Excuse me. I recognize that the person might be minimizing the signals, right? They might be pushing it off as, oh, it's not so bad, you know, but in reality it could be something very bad. Other types of common illnesses or diseases we could be dealing with are Alzheimer's. And Alzheimer's disease is when somebody is actually starting to lose memory. They could become violent. They could become somebody that you don't even recognize out of nowhere. Okay, this is when there's altered thinking patterns. There could be confusion going on as well. Sometimes older individuals, not outside of Alzheimer's, right? They are at higher risk for injuries and falls, resulting in fractures of hips, legs, arms, shoulders, you name it. They also have then the increased risk of head injuries since they cannot stop themselves from falling and they could hit their head even more. And then they are also going to be more susceptible to those extreme temperature conditions, hot and cold. So treat them as if we would with any other person, but we want to be even more paramount with our capabilities. We want to ensure that we're really taking care of them even more since they are more susceptible to these possibles. A person with disabilities is somebody we could be theoretically dealing with then too. This could be a person that has absence or loss of motor or sensory function, even a mental impairment going on. A mental impairment is a damage usually or a reduction in quality, quantity, or a value of a function. So when we are dealing with people with these possible disabilities, first and foremost, we want to speak to them before we touch them, just like with everybody else. You know, ask them how you can help. Do you need help? Tell them your level of training. And then ask for assistance and information from them and from others around too. What you can also do is do not remove any assistive devices that is helping this person. We do not take away anything that is helping them. And then we also look for medical tags, medical ID tags. Maybe they cannot tell you what's going on. So if you can find that tag on them that tells you, right, something severe is there's some kind of disability going on with this person where they cannot communicate with you, look for those issues, look for those things. Here's a silly thing. In my wallet, I keep a sign language card because I could be dealing with somebody who is possibly deaf, right? And they cannot hear me speak or understand the words from my lips just by reading them. So I actually have a card showing all the signs for the letters. That way they can communicate with me, I can communicate with them if that situation ever did arise. Of course, you can pull that up probably on your smartphone these days. And then also be aware of any kind of animal assistant then for these peoples that are disabled or impaired. Oftentimes they have their seeing eye dog or their safety dog with them. Always keep that animal right next to their side. Never touch that animal because that's not your job. The only reason we'd ever touch that animal is if that animal has some kind of harness on them that carries the person's medication or information. And that's the one time where we can grab something from that dog to help that person. For people with total hearing loss, like I said, maybe they're deaf, right? You can ask them things non-verbally even too. You can, make signals, make signs, I guess you could say. There's always universal signs of yes and no. We understand that, but there could be way of pointing and so on and so forth if you don't have a way of communicating with them with hand signals. Other things that we're doing then, maybe for instance somebody has partial or total vision loss, we have to explain to them even more what's going on or how we're helping them. We can always, if we need to move that person and they can walk, we can have them hold onto your arm so they're alert, and then walk around obstacles, and always keep their seeing eye dog with them at all times. Always keep those two best friends together, I like to say. Moving into motor impairment, care for all problems as if they are new to you, right? That's the big thing there. And when in doubt, right, you think this is life-threatening condition, call 911. If somebody has a mental or cognitive impairment, what we can do is we can approach the person in the same manner as everybody else. Be polite, ask them who they are, tell them who you are, right? And then listen very carefully. Explain to them everything. And if the scene does become unsafe with that person, if they do become violent or something of that nature, remove yourself and call for help. Somebody with a language barrier, that could be very difficult then too. Maybe you have a bystander there that can translate for you. That's a best case scenario. Otherwise, communicate non-verbally, and when in doubt, call 911. Oftentimes an EMT can be a translator, or they'll bring a translator with them. Let's move into crime scenes and hostile situations. Crime scenes and hostile situations, we want to use very much extreme caution. So first off, we want to call 911 or the local emergency number and stay a safe distance away. We do not want to enter a scene, and we do not want to enter a scene either of a suicide too. If you are unarmed person, if the person is unarmed and they're threatening suicide, call for help. Pretty easy with that one. And if the scene is safe, keep the person talking until the help arrives, right? If you are away from the scene, call 911. Do not try to put yourself into the scene. It's only if you are already there in the scene, that's the only time you should stay there at the scene. And don't, again, try to approach the person. Try to speak to them at that distance that you're at. Don't make them feel threatened at all. Leave or do not enter a scene if there's a violent weapon or a crime being committed. Pretty simple there, right? You're going to get yourself possibly hurt in the process. Don't put yourself in towards danger. Another thing, don't approach a scene of sexual or physical assault. Again, call 911 immediately. And then last but not least, if a person refuses to care or threatens you, withdraw yourself and then call 911. That's a great place to stop, all right? I have one more video to make, and that's going to be covering informations pertaining to child delivery. And then last but not least will be remote disasters, wilderness disasters, and emergencies. We'll cover those two aspects, and we will be right there at the finish of our information for first aid. So that'll be good for this video. Be prepared. I'm going to be posting 2 more videos. All right, make sure you watch both these videos. What I'm going to provide to you on Blackboard is a link where you can open up your test and you can take your 30-point multiple choice first aid exam. I will need you to send that information to me via email, fog0845@yahoo.com. Please do follow me on this channel. That way you're up to date with every video that I'm ever posting, particularly for first aid, CPR, and first aid utilization skills. Thank you so much. This is Kyle Fogle, American Red Cross instructor, signing off.